Our Madeline O'Neill spoke with a doctor from SSM Health today where this latest patient went to be diagnosed, and she joins us with more on how health officials responded and the processes they go through to limit that spread.
SSM Health is asking those who are at risk for coronavirus to call ahead. That's what the most recent Wisconsin coronavirus patient did before going to one of the health system's undisclosed urgent care sites. And SSM officials say that makes a big difference.
We plan for the unexpected.
Like the outbreak of the novel coronavirus, which just a few months ago wasn't on anyone's radar.
It's a novel virus, so there's not natural immunity out there.
That makes planning all the more important.
We practice for this type of thing all the time.
When over the weekend, a patient who had been traveling within the country called the nursing hotline with coronavirus-like symptoms.
We were able to meet this individual outside of our care facility, escort them through an area where there was no patient contact, put them in a proper isolation room. We were able to mask them and assure that all of our staff had personal protective equipment.
Mark Thompson, the president of Medical Group's SSM Health Wisconsin region, says keeping the patient as isolated as possible means minimal risk to other patients and staff.
We can slow the spread. We can care for the really sick patients. We can manage some of the workforce needs that we have in healthcare and other important sectors of our industries.
With a little planning, the rest of us can do our part too.
Through good public health practices, social distancing, washing those hands for 20 seconds, not touching our faces, we can reduce the risk of spreading this.
SSM says a similar process to treating the coronavirus patient has been used with other potential cases which have come back negative. Now, unless it's an emergency, SSM recommends that anyone who has traveled to any states or countries where there's a coronavirus outbreak and has flu-like symptoms call ahead before coming in for a visit.